Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to go over 4 strategies to help you succeed in nursing school. So nursing school is tough. It requires a lot of studying and a lot of dedication. And many new nursing students quickly figure out whenever they're in the program that they are going to have to put 100% of their time into studying. So in this video, I want to give you 4 strategies on how to make it easier for you and how to succeed with it. So let's get started. Okay, strategy number 1. I recommend using a planner. I could have not got through nursing school without a planner because a planner helped me use my time more efficiently, because in nursing school it will be using every single day of the week up. Either you're going to be preparing for exams, completing projects, going to lecture classes, or you're going to be going to clinicals, and you've got to space out your days for studying, for going to clinical time, spending time with your family, and things like that. And a planner helps you do that. And this could be either a simple app on your smartphone or a calendar notebook, whatever you choose to use. And I love my planner because it helped me develop a study schedule. For instance, say I was going to have a test in 2 weeks. I would block out time throughout those 2 weeks of whenever I was going to study, from exactly the time, say from 2 to 4, I was going to study for pharmacology. And then the next day from 2 to 6, I was going to study again for pharmacology. And it just helps you develop that study schedule. And if you stick to it, you will find out that you use your time really wisely and get a lot of things done. And it eliminates those surprise exams and project due dates that all of a sudden catch you by surprise. So I love using a planner. Okay, strategy number 2, utilize your clinical time wisely. Whenever you go to clinicals, try to be a person who is assertive, who asks questions, who will volunteer to do something. Like for instance, a lot of times whenever I was in clinicals, nurses would come to us and say, who wants to start an IV, or who wants to watch me insert this Foley? And many of the nursing students would just look at each other and be really timid and shy. So don't be timid. Be willing to get your hands dirty. Be willing to help out, because not only is this going to help you learn better, but it's going to show your preceptor, your clinical instructor, that you are willing to learn, and they really like those type of qualities. And also, using your time wisely in clinicals, other than maybe texting on your phone or surfing the web or looking through one of your textbooks, it will help you, being in the real clinical setting, to connect that theory that you've learned in class with what goes on in the real world. And this will help crystallize that information that you need to know for exams. For instance, I remember whenever I was in maternity nursing during my OB clinicals, and we got to watch a vaginal delivery of a baby, and afterwards we got to assess the placenta and look at the umbilical cord. And it really crystallized in my mind how the placenta set up, what side is shiny, what side is dull, how many arteries, how many veins are in the umbilical cord, and I will never forget that because I actually seen that in clinicals. So it really provides you really good time to learn this information. And last but not least, it allows you to network. You never know if this may be the unit that you're going to be working on after you graduate, or this person that is your preceptor helps you get a job, or you form relationships with people you may be working with later on. So that's another reason you want to use your clinical time wisely. Okay, strategy number 3, use a study guide book for those hard classes. Again, I could have not got through nursing school without a study guide book. A study guide book, which I'll go over what I recommend here in a second, is just a supplementary book that breaks down the key material that you need to know for exams. And it usually comes with practice questions, with rationales, and it just helps you focus study, because nursing school contains a lot of material that is really in-depth, and this right here, these study guides just simplify it for you. So really, for those tough classes, especially pharmacology, medical surgical nursing, fundamentals, and patho, those are the classes that tend to give students a rough time. I recommend a study guide for those. What study guide I recommend personally, I use it all through nursing school, was the Saunders Comprehensive Inklex Review Guide. This not only helps you review for Inklex, which is your licensing exam, in order to become a registered nurse, but you can use this book for all your nursing classes. It covers mental health nursing, maternity nursing, med-surg, everything. It's a thick book. It comes with thousands of practice questions, and it breaks down the material for you. So I really recommend for those classes that you're having difficulty with, use a study guide to help you prepare for those exams. Okay, and strategy number 4, practice hundreds of Inklex-style questions prior to lecture exams. This kills 2 birds with 1 stone, because not only are you going to be studying for your lecture exam, but you're also going to be practicing and studying for that Inklex exam that you're going to have to take after graduation. And exams in nursing school are so important because that is what makes up majority of your grade. It's not care plan projects or other projects. It's really what you're scoring on the test. That's the big bulk. So you want to perform well on exams. And before an exam, say that you have an exam coming up and it's going to be covering post-op care of the patient. What you want to do is you want to get your study guide. You want to review those sections in the study guide over post-op care. Then you want to practice Inklex-style questions, at least like 1 to 200 about a post-operative patient. Because you're going to see that your professor is going to use Inklex-style critical thinking questions on their exam. And you're going to see these repeated concepts over and over. And it will help you understand what will be asked. And then after you practice these questions, read the rationales of what you got right and what you got wrong so you can understand it whenever you have to take the exam. Okay, so those are 4 strategies on how you can succeed in nursing school. I hope this helps you out, and I wish you the best in nursing school. And be sure to check out these free nursing student resources, such as my website, Registered Nurse RN, which contains care plans, free quizzes, salary information, everything to help you from nursing school to getting that job. And my YouTube channel, Registered Nurse RN, which has a lot of free videos on how to study for nursing school classes, Inklex reviews, and things like that. So thank you so much for watching this video, and please consider subscribing to this YouTube channel.